time. This is a different computer. Okay.
Hey, Kim.
Hi.
Hi, Kim.
Hi.
Morning, Kim.
Good morning, everyone.
Rose. Sean, where are we at with respect to?
Can you hear me now?
Mm-hmm.
With that, then I'm going to call the Health Committee meeting to order at 9:33 on my clock here, and ask to begin. Ms. Chaput, has the roll been called?
Yes. Oh, everyone's here.
Thank you very much. Are there any disclosure of pecuniary interest, and if so, the general nature thereof? I see none. Can I have a motion of the minutes of the meeting? I think I will do these each separately, of the meeting held June 10th, 2020 that was circulated previously. Moved by Councillor Bennett, seconded by Councillor Murphy. Any errors or omissions? With that, then, all in favor? That is carried. Thank you. Moving on, then, can I have a motion to adopt the minutes of the meeting held June 24th, 2020, again as circulated previously, moved by Councillor Frenier, seconded by Councillor Grills. Any errors or omissions? I recognize none. All in favor? That is carried. Thank you. With that, I see the death stare of Paramedic Chief Nolan. Mr. Nolan, Chief Nolan, I will, oh, there it is, a much more happy visage right now. Chief Nolan, it is yours to have the floor.
Thank you, Mr. Chair, to you and members of committee. I may change that picture eventually, but it's become a bit of a trademark for me. So I'll leave it there for now, if that's okay with the group. Still does confuse some people and have them believe that I am paying attention sometimes, so it is helpful. In terms of my committee report for you today, there are two main parts. Of course, there's the committee report and then the treasurer's report up until the end of June for your review. But we'll start off with the health committee report. And the first thing I'd like to provide is a bit of a COVID update. I'm sure, you know, on everyone's mind. But what I've tried to focus on in today's report is specifically as it pertains to the impact on our service, especially on the back end. It's kind of behind the curtains view of the impact, because we've had significant challenges over the previous 16 to 18 weeks managing personal protective equipment, for example. And you'll recall a previous story regarding PPE and labeling of surgical masks as medical, non-medical, and the like. So that continues to be of significant debate right across the entire healthcare system in terms of what is the appropriate level of PPE. And you may have seen yesterday's New York Times health article, once again questioning whether COVID is in the air, even in the absence of an aerosolized medical procedure. So this will continue to be a challenge for us. Simply managing and tracking of equipment as it's kind of moving through the system continues to be a challenge. There are, while it's no longer in the media to the same prevalence it once was, the access to appropriate equipment continues to be a challenge across the entire healthcare system. So said differently, there is still as much a supply chain issue for certain medical devices and personal protective equipment today as there has been in all months previous related to COVID. And I think N95s are probably the greatest of the hen's teeth that are out there in terms of difficult to find and difficult to procure. And then once we get them in stock, ensuring that they're being used at the appropriate times with staff. Staff have been exceptionally accommodating in terms of now having been fit tested for 7 to 9 different types and styles of masks that are commensurate or intended to be commensurate with the N95. And then we have our surgical mask supply. So as schools start to reopen, demand for masks is going to skyrocket, as you can imagine, not just for the staff, but also for the students themselves. What remains in question is the efficacy of cloth masks and so on. So the evidence is continuing to roll out. The distance requirements will continue to roll out, and all of these cause significant challenges for my staff internally in terms of being able to manage not only the supply chain, but now being able to manage the costs associated with those supply chain challenges, because costs have skyrocketed as it pertains to the things that we rely upon for personal protective equipment in our service. So that's bringing to bear, I'm sure, challenges that are not dissimilar to what you're experiencing at your municipalities, but I think it's really important to know that this is going to be an exceptionally difficult year financially for us on the PPE side, on the staff required to be able to manage the PPE, and save and accept our involvement on a day-to-day basis related to simply managing the patients that we have in the community, the increased requirements for disinfection and the amount of time that that takes you out of service within the community. And as we move into the flu season, where the symptoms of flu and the symptoms of COVID are virtually identical, that is going to place a greater reliance, once again, in terms of the amount of time it takes to do a call, to clean up from the call, the amount of PPE that's going to be used on the day-to-day operations of the service. So something you might not think about, for example, is that we've had to increase our storage capacity by over 300%. So we've been fortunate that Laura's team has provided us some additional space in Renfrew, simply to be able to manage all of the supply that's coming through in the fits and starts that we've been experiencing. That is also coupled with our involvement from a COVID testing perspective. We have approval by the province for our involvement within the COVID testing. And I don't think I need to remind anybody that's on today's call in terms of the efforts that are being made by the paramedics and our partnerships with public health. But I think it is worth noting that we're also in the midst of what we're trying to achieve as vacation season. So there's a lot of competing pressures, because we know, or we believe, I believe, that when the schools reopen, we're going to have new pressures upon us in terms of potential outbreaks. Public health will be doing a lot of contact tracing, and there'll be an increased number of tests required within that sector. Our last sector of concern was long-term care, retirement homes, and congregate care. Now we'll be moving into a predominantly pediatric population, as well as working with the schools and the school boards. So we have been meeting with the school boards to date in terms of what their intentions are, what their plans are, and how we need to shift our stance around drive-through testing to perhaps congregate testing within schools and classrooms. And so we're looking ahead to other jurisdictions and seeing the rebound effect, for example, as it pertains to an increased spike in number of cases. And I think you've all probably followed what's been going on in New Zealand over the last few days. And I think it sends shivers down all of our spines to learn that with really just a spark of new cases, they've gone into virtually complete lockdown, except for essential workers in that country. And I think that we all need to come to terms with the fact that that is highly likely, that we will have a similar experience and a similar rebound in terms of the stage 3 to stage 2 to stage 1 in Ontario, and potentially here specifically in Renfrew County. So we need to be very conscious and cautious of this isn't a one-way street out of the pandemic. This is likely going to be a back and forth for some time. And I think that we all need to be conscious of that. We're in a bit of a lull right now, I would say, by perception for some, in that things are absolutely improving in terms of the numbers. But when we come into what I'll consider mass reopening in September related to in-class learning, as well as how that's going to change parent behavior by having the children away at school, and perhaps a desire to get back to offices and social gatherings, and some of the conversations that we've had amongst this group about, oh, we miss each other, let's get back together. We need to be very conscious and cautious of how, where, and when we do that in this roller coaster, as I would describe it, that will be fall leading into winter and likely into next spring. Right now, we have the luxury of sitting on patios come December, January, February. We're going to have to be making different decisions, as we are also analyzing our ability to do drive-through swabbing in those coldest months of the year. So it's going to affect our ability, but also our stance in serving the public if we're to continue beyond the end of August, September with the swabbing in the way that we're doing it. And the reason I bring that up is because the province has come out to say that their intention is to reconcile all of the efforts and the funding associated with the assessment and triage by the end of August, with an intention of that by the end of September, they'll have a new plan in place for the go forward ability to swab and assess and test people in Ontario. So I do sit on a committee representing all the paramedic services in Eastern Ontario. There is frankly a lack of specific information to be able to share with this group at this time because everything is still in the discussion and planning phase. But I think the bolder to understand in all of that is by the end of August, there's to be a reconciliation, certainly from the finances associated with the expenditures to date across Ontario. And then by the end of September to have a plan in place on a go forward perspective. So I'll leave it there, and there may be questions as we go forward. But suffice to say, COVID has been a very dynamic experience. I'm exceptionally proud of staff and our partner organizations in the way that we've been able to respond to this. And I think that we've learned a lot, but we continue to have a lot to learn, as do all of you. So as we move on this from what does it mean from a governance perspective, what does it mean from a service delivery perspective, the one assurance I can give you is that the way that we deliver service is vastly different from the way we delivered service a year ago. And the cost associated with that can only go up based upon our experience in supply chain and the supports required to be able to manage that effectively. And a small example of that is the province requires very detailed, up-to-date reports on a regular basis related to our PPE. That in itself is virtually a full-time job, being able to maintain the reporting requirements for the province. So just want to make sure that everybody is aware of that. I think our best opportunity right now is to engage the school boards as we are, and to try and take a measured and deliberate approach, not only to how they're going to resume in-classroom learning, but what happens when someone has a sniffle, someone has a cough, someone has a fever, someone needs to go home, someone needs to be tested, an entire class may need to be quarantined until test results have been brought back. What happens if a family member of a student is under investigation as well? So you can imagine with all the sniffles and things that happen out there, this is going to be a very difficult fall season with or without the schools reopening. But I think that we're doing everything we can right now to be proactive and work with the stakeholders within that sector, and we'll see how it goes. Item number 2, Mr. Chair, related to virtual triage and assessment centers. I'm very pleased and grateful to the warden who was able to establish a meeting with the Eastern Ontario Wardens Caucus to discuss the advantage that we've been able to achieve with the Renfrew County Virtual Triage and Assessment Center. A big thank you to the warden for representing this issue so vigorously and so passionately, because I think as she has said many times, this is the first time that everybody in Renfrew County has had access to a primary care physician. And if they are the gatekeeper to the healthcare system, there's an obvious advantage to being able to not only provide this service, but to maintain it. And so to remind you, the province is looking at, by the end of September, implementing a model that has a funding component associated with it. And obviously, what is unique about VTAC is we have medical receptionists working virtually. We have primary care physicians working virtually under sessional fee codes, meaning they're paid an hourly rate for the services that they're providing for virtual care. And we're also receiving funding for community paramedics to be able to further that care in the home, in the community, and as well provide remote monitoring and ongoing assessment. So to do that, as I said previously, I'm on this committee looking at what is the optimal assessment center model, and you can be assured that I've been advocating that our experience from a VTAC perspective should in fact be a model of care, not only for Renfrew County, but for all Ontarians. And that we've been able to demonstrate that while medical receptionists, primary care physician, and community paramedics play a significant role in that VTAC model, so too do our hospital partners, our primary care family health team partners, and we've been able to build out a number of care arms from that model. For example, palliative care. So as you can see further in the report, COVID has lit a match under the sector to say, look, we need to work more closely together. We need to find better ways of managing patients in the community with or without COVID. And I think that in many respects, COVID has brought us closer together, both as a community and as a medical community, to do the things that people have wanted to do for a long time, but be able to prove it out in a short but intense experience. So when you look at the statistics associated with what we were able to achieve up to July 26th, for example, almost 12,000 assessments completed, and at that time, almost 11,000 total tests completed in Renfrew County. So these are amazing numbers. And when we look at the number of people in Renfrew County that do not have a family doctor and at times do not have access to a family doctor, the demand and the need is only going to increase to be able to maintain a service such as VTAC. So we are petitioning and the warden has received support from the Eastern Ontario Wardens Caucus through resolution to be able to support and advance the role of the VTAC. So Mr. Chair, I imagine the warden will want to speak to that during the question component, as she's been an exceptional champion, as have you, on these issues related to the VTAC. So I'll leave those comments there. Item number 3, related to community paramedic palliative care. As I spoke to previously, this is an arm. So when you think about, one of the ancillary benefits to the VTAC, one of the clear ones is that those physicians with expertise, such as Dr. Rowan and Dr. Forfar, and the list of others within the county, such as Erin McCabe and Stephanie Knox and Dawn Cruchet, have really come together with a group of physicians and a group of primary care providers and paramedics to find a better way to be able to manage those episodic needs of patients with palliative care, a palliative approach to care in the community. And I think that that's important because on the 911 side of the house, we often see people receiving a palliative approach to care who have an abrupt change in their condition. And the typical palliative care scene is not designed to be nimble to be able to manage those abrupt changes and manage the family and patient expectations at that time. The paramedics have the knowledge, skills, and ability to be able to manage, for example, a change in breathing or a convulsion or excruciating pain that may come or go for a palliative patient. However, the historic expectation was that paramedics would simply take them to the hospital after providing some baseline care in the home. So by working together through this palliative approach to care model, paramedics are now doing, for example, a subcut line, which is a subcutaneous line, which is a line that stays in your body, and then medications can be delivered through that. So you're not getting a poke every time you need a pain medication, for example. When we look at the opportunity and the leadership from Dr. Rowan and Dr. Forfar, we've also looked at, the amount of narcotic that we're carrying, the amount of drugs that we're carrying, what are alternate uses of the drugs that we're carrying to be able to better manage someone receiving a palliative approach to care. So Andy Brown has been working with Renfrew Hospice and been doing rounds for some time. This is not a new concept for us. This is just a more formal, structured way of us being able to support palliative care in the community. And I think that that's an important point, is we're not strangers to supporting palliative care. We're just now able to do it in a more rigorous and structured way. And I think that predictability will certainly benefit patients across Renfrew County. Item number 4 is related to the community of practice. So we've taken a leadership role through now Deputy Chief Matthew Grenier, where we have established a forum for all paramedic services in Eastern Ontario to get together and to standardize our approach to community paramedicine, both related to COVID and outside of COVID. And I think we now have enough years of experience under our belt. We should be able to decrease the amount of variability in what it means to provide community paramedicine, and also demonstrate to the province that there have been significant benefits. And when we say what community paramedicine means across Champlain or Eastern Ontario or the EOWC, that we are being consistent as much as possible in not only the definition, but in the delivery of that service. And I think that that's just an important maturation through the process. So this community of practice is about sharing information, learning from one another, and being able to standardize our approach as the province is now starting to show some renewed interest in community paramedicine and the role of paramedics in preventing 911 calls, but also preventing hospitalizations and unnecessary burden of disease in the community. Item number 5, Mr. Chair, is related to 2 positions that we were able to solidify over the past month. So I'd like to congratulate Deputy Chief Matthew Grenier. He has been successfully promoted to the position of Deputy Chief, replacing Michelle Rouet, who is retiring at the end of this month. So a big congratulations to Matthew. And as well, we've been able to promote Ms. Amber Hultink. Amber has been selected as a commander through that process. And as you recall, we've had a significant number of positions that have turned over in the last little while. Certainly Michelle's retirement was allowed us to move forward with the deputy position, but we also have one commander who will be off for an indeterminate amount of time. As well, we have Richard Lusink, who had retired, and with Matthew moving from commander to deputy chief, we now have a vacancy that's been posted to fill there. So we're moving to try and advance as many of these positions and reduce the number of actors or acting commanders that are in these positions. And I think that stability is good for the workforce. We do also have JD Heffron, who is out of the workforce at this time on secondment to Indigenous Services Canada. And I did recently approve a 2-month extension until Halloween for JD, as he's been playing a pivotal role in both the implementation of community paramedicine with Indigenous Services Canada, but also in relation to their command structure in their COVID response. And it looks like today he's probably going to be dealing with some wildfire evacuations in northwestern Ontario as well, because both Red Lake and Fort Hope are now under threat. So that is just a quick update in terms of our staffing. And I will be moving forward with this competition that recently closed as it relates to the subsequent vacancy that we have from Matthew's promotion as well. Item number 6, Mr. Chair, related to letters of gratitude. We've, sanitized or redacted some of the information within these letters to respect confidentiality or businesses within the area, but I think it's important that you see the feedback that we received from the community. The first one related to a cardiac event and the appreciation for the paramedics in the recognition, diagnosis, and early treatment for that individual. There's also a longer story within today's report as it pertains to one of the Sierra team calls that we've participated in last month. I will say that the Sierra team is going out at least on a weekly basis right now. We have had significant involvement in the community, on the rivers, on the trails, in the park, in the ZEC over the last little while. And I think that that this story is really a good news story when you look at the intent of the Sierra team, which is to provide a consistent, comprehensive response to an austere or very difficult environment. And the Sierra team, as you recall, last year, we did joint training with the SARTEX from Trenton. That continues to bear fruit, given the exceptional collaboration between the paramedics, the park staff, the SARTEX, the OPP, Orange, and others that came together for this heroic tragedy that occurred within the park. And I think that when we look at the family reaching out and thanking us for the involvement, we also wanted to take time to acknowledge the bystanders associated with that. So I have reached out to the other individuals that did an incredible job in caring for this individual and supporting the paramedic response. And I have crafted 3 Chiefs commendations for those individuals, and Amber Halting will be delivering those virtually on our behalf as those individuals live outside of province. But really proud of not only the work that was done on this call, but all of the work that's been done leading up to this call to ensure such a seamless interagency response, in this case, into the park on the Acre side, nearest the Barron Canyon, High Falls area. As well, item number 7 from an interagency collaboration, there's more detail there for you as it pertains to the story in number 6. So I'll leave that there for you. Item number 8 related to the CSSP. So that's the Canadian Safety and Security Program, which is the agency that Michelle Rouet is now retiring from. And they were good to involve us in a project looking at vulnerable populations during a crisis. And how do we best track, identify, and support vulnerable populations in the community? And I think an example of that is, I don't think it's a surprise to anybody, but there is a homeless population and there is significant poverty in Renfrew County. And during times of COVID, it's been difficult for people to seek shelter, to congregate care or receive congregate care, and to live in places where they may have otherwise previously been welcome. So this is really a bit of a give and a get for us, in that we're here to support the Canadian Mental Health Association, and I hope also work with our partners in community and social services to be able to better support the population here in Renfrew. So look forward to signing on as a participant, not a lead agency in that project. As well, when we look at how we support the VTAC, certainly research and the gathering of evidence is an important component to, I guess, our philosophy to change here in the county. So I'm pleased to provide you a copy of an article that was published with the Canadian College of Family Physicians and their journal, looking at our impact using 24/7 healthcare for all during COVID pandemic, being the VTAC itself. So as you recall, with the community paramedicine, we published a number of articles, we've socialized the concepts, we've provided evidence to not only talk about our experience, but also talk about our impact on the community. And very pleased that Chelsea Lanos, who's one of our paramedics, stepped up during the COVID to take on our role, or telling our part of the story as it pertains to this article. And as you know, we do an annual research symposia, and Chelsea has been the person who's been organizing that work for us. So a big thank you to Chelsea for her involvement in the publication of this article. And then lastly, the Treasurer's Report, Mr. Chair. So I'm happy to either continue on through the Treasurer's Report or pause, answer questions related to the body of the report, and then answer any questions as it pertains to the Treasurer's Report, or give you a high-level overview.
I think what we'll do, Chief, is as it is item number 10 on the report, I think we will continue any highlights that you wish to bring in front of committee at this point. Then we will return to item number 1 and invite question comment from the committee.
So as it pertains to the Treasurer's report, thank you, Mr. Chair, there are a couple things to point out. First off, this is the Treasurer's report until the end of June. So we're a month and a half beyond it. So the numbers need to be taken in that context, given that the second quarter of this year has been extremely dynamic. When we look at a couple of things that stand out for me in this report, the first one being admin salaries versus operational salaries or paramedic salaries. As I mentioned previously, there are a number of actors, or had been a number of actors in commander positions. So normally that would be paid out of the admin line, but because they're actors and are being paid out of the operations line, there needs to be a reconciliation between those two lines at finance so that the admin salaries line is sitting at 100% spent, and the paramedic salaries line would better reflect hours that do not include actor time within that grouping. There is also a pressure on the paramedic salaries line as it pertains to COVID. COVID's changed our business in a number of ways. The first being, you'll recall, we did not previously pay for time and a half for vacancies. We would fairly regularly end up downstaffing whenever it was unavoidable. Since COVID, we have been offering shifts at time and a half to staff when staff are not available at straight time for vacancies. Vacancies were created for a number of reasons, not the least of which were sick, but also a significant number of staff at different times that were in quarantine or unable to be in the workplace. So there is definitely a pressure as it relates to salaries on that line. We also have had an increase in the number of staff engaged. The process for paramedics' involvement in COVID swabbing and increased community paramedic home visits was that the Arnprior Hospital was the funding agent on behalf of the ministry. So we had submitted a plan to Arnprior. Arnprior submitted the plan to Ontario Health. Ontario Health submitted the plan to the Ministry of Health. We had a green light through that approval process, and then the province has not been flowing money through that mechanism to date. And that, as I mentioned earlier, has been the commitment that those accounts will be settled by the end of August. So the Arnprior Hospital has been an excellent partner in this process, but they, like all other hospital partners, have been unable to receive funds to be able to transfer funds. So the costs associated with that are showing up in our budget without an offsetting revenue, which I am anticipating by the end of this month. So stay tuned for that. There's an interesting dynamic at play related to vehicle operation and maintenance, and that is our call volume, as you recall, dropped. Certainly our interfacility transfers dropped precipitously, which means that our kilometers on the fleet dropped because we're no longer taking people from Barry's Bay to Ottawa or Pembroke to Ottawa at the rate that we previously were in that period. However, we had more vehicles on the road given our involvement in COVID response and community paramedicine, and gas prices, as you will all recall, significantly reduced for a number of months. So our costs associated with operating those vehicles went down by a significant rate over this same period. So I think that that's important to recognize that we have increased staff costs, we have decreased operating costs from a vehicle perspective. So I'm not sure how these things are going to play out by the end of the year, but unfortunately, none of these costs are avoidable based upon the service delivery commitment that we have today. However, we're going to continue to evaluate, obviously, our efficiency and our performance. But as I had said previously, we're now seeing vehicles in significant offload delay in Ottawa hospitals. I know vehicles were tied up between 6 and 8 hours in offload delay over the last few days at the general campus and at the Mulfor. So we need to do everything we can with our hospital partners so as not to be sent to the city unnecessarily, which puts us then in the mesh of those issues that are bubbling up on the Ottawa hospital and at the Mulfor. As well, from a PTSI and fatigue management perspective, certainly that's a money in, money out project from the federal government, and those funds will continue to ebb and flow based upon the contractees that we have, such as Conestoga College, who is managing the evidence and the research associated with that. So that one's going to come and go. I see there's a variance for about $10,000 at any given time, but by the end of the project, that will flush out to be a net zero in terms of our expenditure versus our revenue. And then when we look at community paramedicine revenues, again, that's based upon the billing period, because we bill on a quarterly basis through what was the LIN and Ontario Health. So those revenues have been committed in writing to us, and that will as well net out. We have had occasion to allocate some of our community paramedics to assisting with COVID and COVID paramedics to assisting with community paramedicine. There's a fluidity there. But suffice to say, we have more resources on the road, more revenue coming in than we've ever had. At the same time, we have increased expenses that are patently out of our control at this time, not the least of which is PPE, call demand, and the pressures as it relates to the amount of time it takes to get a call done. When you double it, the amount of time it takes to do one call, that puts a strain on our system across the board, and we're certainly feeling that strain, especially with the increased number of people that we're projecting that are in the county right now and the increase in recreation activities. It's certainly been a challenge for us that has been unprecedented, let alone COVID and the pressures that come with that. Mr. Chair.
Thank you very much. A very comprehensive report, Chief Nolan. Just before we get into questions, I'm still uncertain if that is a look of frustration or rapt attention from Councillor Reguer. Can you confirm, Councillor Reguer, if you are hearing us? I will take the nod as a confirmation. Thank you. Very welcome to have you also. Good morning. With that, we'll go to item number 1, the COVID-19 update. And I saw that Councillor Lafreniere, you had your hand up.
Yes, thank you. Mr. Nolan, in regards to the opening of the schools, I know that there's been a lot of testing going on for different groups of people, essential workers, family of seniors, that type of thing. Was there any mention in your discussions with your contacts at the different boards, any discussion about pre-admission testing for teachers, staff at the schools, or anything to be a little proactive about sending them in herds to the schools? I know that the big fear is, although our numbers are low, the big fear is that there are some sleeping viruses out there that we don't know about, that are maybe people are infected, they're not showing symptoms, that type of thing. But was there any discussion about encouraging staff, teachers, parents to get pre-tested before the school year? Because to me, it would make sense that maybe we could find some of these viruses that could be lurking out there. Was there any discussion about that at all?
Thank you. Yes, and through you, Mr. Chair, that certainly is a point of discussion, and often kind of falls back, if you will, to this notion of testing asymptomatic people, and that's where we're trying to follow the tea leaves from the provincial medical officer of health. We've had great clarity at the local level in terms of the prevalence of false positives, for example, when you over-test in the asymptomatic population. Public health has been a part of these discussions as well. And unfortunately, I'm not able to say that we've landed on a solid approach to date. Part of it is trying to understand what the provincial tenor is related to testing of asymptomatic people. And I'm even hearing as recent as yesterday that we should be not testing asymptomatic people, which then is more likely to lead people to say that they have symptoms as it pertains to the disease. So we don't have clarity, to be clear, Councillor Lafreniere, in terms of whether we will or will not be doing asymptomatic testing of staff or students. The paramedics are getting refresher testing right now from CHIO on pediatric swabs. And of course, this also enters into the discussion around daycare and the very pediatric population, and the warden's been good to ask where we're at with that as well. So these are specialized populations that will be looking to public health for their guidance. But what we're trying to do is maintain a high level of flexibility in the way that we're approaching the testing and assessment in the community. And the way that we've been able to do that to date is to maintain a stable of capacity with our staff, do pre-scheduled, as you've probably seen on the vtac.ca website. We have certain days of the week where we're doing testing in certain communities. We're trying to move that around. Public health has been great to work with us in Pembroke to do testing there, I think on Wednesdays. But as we move into this next phase, the school board is obviously looking to their ministry. We're looking to public health, because more testing doesn't necessarily equate to finding disease. Sometimes you end up finding false positives at a higher rate when you get into the mathematics of it. But there's no doubt that we want to be able to be proactive, but also responsive in the way that we're managing this. And we don't have the epidemiologic data to suggest what is best at this time.
All right, thank you. Any further questions? Just on closing off item number one, and I think that without directly making that inference unmistakably on several of the comments Chief Nolan made, there is still much that is being gathered about the nature of COVID-19, still the question of aerosolized versus non-aerosolized, masks, et cetera. I think also the experience in New Zealand has given everyone pause also. I certainly don't want to, I'm not belittling this, and I don't want to risk raising the elevation of anxiety. I don't think it's appropriate for that, but the virus is oblivious to what we care about, whether it's here or not. And when our guard is let down, it takes much advantage of that, in my estimation. Or in my analogy, I guess, what it seems like up front in our response to this conflagration was to remove all the fuel so as to make the fire go out. But as soon as we begin to add more fuel to it, which is us, it is returning also. And the experience in New Zealand, I think, has brought focus to that. So the sense of normalcy, I think, that is being experienced is just that. I think that COVID normal is probably going to be here for quite some time. And that's why it is so absolutely essential, once again, to repeat these small but enormous powers each of us have, which is wash your hands, don't touch your face, and wear your masks. I often am seeing now, why are we instituting the masks when we have it under control? Well, largely we got it under control because we sent everybody home and barred the door. And now we are returning to an open economy, and it is going to bring with it the same experience that New Zealand has. All of these things are going to keep it somewhat in check and allow for our health system to be able to cope and to diminish the impact on human health and well-being. So, moving on then to item number 2, virtual triage and assessment center. I don't see the hand up, but I do see Councillor Love, but I'm going to first defer to the warden, because I know that this has been a very elevated and weighted concern, the VTAC and the efforts that the warden has put into this. So Warden Robinson.
Thank you very much, Chair. It's certainly, it's one of the priorities of the entire County Council. So, when VTAC was created, it was unprecedented collaboration within the healthcare sector in the entire county of Renfrew. And I'm very pleased to see that collaboration is continuing to this very day. Recent statistics that I have is that 24,000 people in the county of Renfrew do not have a family doctor. That's terrifying. I'm also personally aware of 3 other physicians that will be shutting their practice down by the end of this year. That's another 6,400 people without a family doctor. So now we're talking over 30,000 people without a family doctor. And those are just the ones that we are aware of at this point in time. It is essential that VTAC continue. I am very nervous when I hear Chief Nolan speaking about what the province is doing and looking at assessing how they're funding assessment centers and the models, that that we could possibly lose VTAC here, and it will be devastating for this community. For years, people who have not had a family doctor suddenly have access to primary care. You know, being able to call, speak to a nurse practitioner or a physician, and, you know, whatever the issue is at that point in time, getting cared for very quickly and efficiently. There's no way to compare that to asking those folks now to go and sit in an emergency room for 6 or 7 hours to be treated. And the reality is that a lot of people either can't get to the emergency or choose not to go. So those are the folks that, you know, probably could have been dealt with, and instead they sit at home. Hopefully they will get better. If they don't, they end up possibly calling the paramedics and ending up going into a hospital in a real emergency, being hospitalized. And that just exacerbates the issue of hallway medicine. So when you think about what VTAC has done for the county of Renfrew, it can do that exact same thing to any community in Ontario, probably Canada. As long as there's a phone system, VTAC will work for that population. VTAC has reduced the number of people showing up in our emergency rooms. That was one of the issues when VTAC was first stood up, was to try to safeguard the surge capacity of our hospitals in case we did have a huge influx of COVID-19. That has worked, and it's continuing to work. So people are not going to the hospital for care that now they can get through as simple as a phone call. The wait times, which are times in emerge, the hospitals are all judged by, those wait times are down, again, because there's not people in emerge that don't have to be there. And the province is all about the hallway medicine. There's less people in the hallway because there's less people becoming severely ill because they get the care that they need. Primary care is so essential to our well-being for all of us. And I think that certainly for the County of Renfrew and County Council, we're going to do everything possible to try to keep this for our county. Chief Nolan did say that I did make a presentation along with Chief Nolan to the Eastern Ontario Wardens Caucus and received unanimous support for that. He has also made presentations to Ontario Health East and Ontario Health West, and all of those folks are supporting what we're doing. So the message has to get through to the province of Ontario. Unfortunately, this is Wednesday, and I still have not received confirmation that we have a delegation in front of the Minister of Health. But if we haven't heard by tomorrow afternoon, I guess it's a done deal. We will be making that presentation there. However, that's just one of the options we have. A letter is going out today to Minister Elliott, outline what VTAC is to us, what it has meant to us, and why it must continue. And I'm at that point in the letter, I am requesting an audience with her to have more of an opportunity to speak clearly and directly to her and to her staff about what VTAC has done for us. The province has funded it, and that's very important. They have supported what we created in Renfrew County. I just want that support to continue. So again, I thank everyone so much for supporting it. I can't thank Chief Nolan enough. He's been a very strong advocate within the healthcare sector, and he continues to do so. So thank you very much, Chair, for giving me the opportunity.
Thank you very much, Warden Robinson. Councillor Love.
Thank you, Chair. I would like to very much thank the Chief and Warden Robinson for pursuing this. In our area, we have a huge shortage of doctors at this end of Renfrew County. And I can't tell you the number of times people have told me this is a great service. People who've actually used this service, whether they had a doctor or they didn't have a doctor. Sometimes you can wait 2 or 3 weeks to get a doctor's appointment when you do have a doctor, especially in COVID. I have a friend who was trying to get a doctor's appointment. She got to the point where she called VTAC because she couldn't get one. And that actually saved her life. I mean, I'm astounded at the care, at the speed, at the ability to get people in, to get them seen, to get them into specialists. The coordination of this service is amazing. We really, really need this service. As Warden Robinson said, I know in our area, we're going to lose another doctor at the end of this year. we're at the stage where we can't continue without decent medical service for our community, and this is providing it. This is taking the pressure off our existing doctors, so we're not going to lose, hopefully not lose more doctors. So please, I applaud your efforts. I support your efforts, and my community is very, very happy with the service they're receiving through VTAC, with the help and assistance that they're getting and the timeliness of it. You're doing an awesome job. Please, I back you, I support you, I'll go with you, I'll go beg, whatever it takes to get this funded. We need this service in Renfrew County. Thank you.
I do, just before I go to Councillor Murphy was next, and then I do see Councillor Reguer, just picking up on Councillor Love, I think every vector, every avenue that we have at our disposal to advance this, and certainly in your capacity on the Roma board, I think that along with Councillor Emo, I think that that is a substantial opportunity to advance what this means to rural Ontario. I think in particular, I think there are aspects of this that would certainly lend themselves to an urban environment as well. But I think perhaps Roma is uniquely situated to recognize, embrace, and advance this issue. So that might be a very good means of advancing this. Yes, Councillor Love.
Yes, thank you, Chair. And if myself and Councillor Emo could receive, if there's a brief that Warden Robinson wanted to present, if we could receive some documentation that we could present to the Roma board, I would really appreciate that, because then we can try to get the backing of Roma as well. This is a solution that could work for rural Ontario and Northern Ontario. Thank you.
Thank you. And perhaps I'll just leave that to go offline between you and the warden and probably Chief Nolan as well, just so as to accommodate all of the questions right now. Councillor Murphy.
Thank you, Mr. Chair. Yeah, I'm with Councillor Love. I'm willing to do some begging as well. I too appreciate the chief and the warden's efforts in this. And I think that the message that we have to drive home is that we are the only ones in the province of Ontario that haven't gone with the bricks and mortar solution at this time. And we're so poised to be a model for all of Ontario and perhaps all of Canada. I'm very disappointed that we didn't get this delegation. I understand that the minister is very busy at this time. Did anybody, I need to ask this, did anybody that asked for an audience with Minister Elliott, did anybody get a delegation? Because Bonashir Valley did not. And we've been looking for a delegation with her since she's been in her position. So I'm just wondering, did anybody else ask for one? Because we too need a doctor here, and I was going to use this opportunity at AMO to say we need a doctor. Oh, and guess what? We're using VTAC. So just as an aside. But thank you to everybody that's behind this. And if there's anything, any warden chief that you need, I'm in.
Thank you, Councillor Murphy. Councillor Reguer, please.
Thank you, Chair. And I will just echo Councillor Love and Councillor Murphy's comments. I do just want to add on a personal note, I had the experience of contacting VTAC last week for a senior family member. And I do just want to say how efficient everyone that I spoke with was. Within 10 minutes, a physician returned my call, our call, I should say. Within 30 minutes, there was a paramedic at our door assessing and advising what we should be doing next. So I just wanted to share that with committee and with staff, how efficient this team really is. And I can't say enough, this saved a trip to the emergency department for a 6 to 10 hour wait. And again, it was just so efficient. So I do just want to just hats off to Chief Nolan and his team. And I do certainly support that anything that we can do to continue this service is utmost important. So thank you for that.
Thank you very much, Councillor Reguer. Anything further? Mr. Morrow.
Thank you, Chair. I just, after given the conversation, I just wonder if there would be the stomach for a recommendation from this committee to County Council asking that all local municipalities support the VTAC concept and advocate for it throughout the county as well. I know the warden has done a fantastic job of keeping MPP Yakabuski informed, but again, you know, if he were to hear more voices on it, possibly it may resonate a little bit more. I will leave it at that and leave that open to you, Chair, for discussion. Thank you.
Certainly the point well taken. Did you think that that would be accommodated through the means of passing a resolution recommending that, or that this simply be brought forward as an information, as when the chair is delivering the report at County Council to make that recommendation?
Chair, I was thinking, given the fact that VTAC is currently in this report as information, it does open the door to allow this committee to move it forward and pass a recommendation or a resolution for the continued support of VTAC. That way we deal with the notice of motion issue sooner than later, and we can bring forward an actual resolution from this committee to County Council at the end of the month.
All right.
I would move that.
Thank you. So if I'm under, and I'll come back to you, Councillor Murphy and Councillor Love. So essentially it is simply that that we have a motion passed here, a resolution passed here, directing staff to prepare a resolution for the County Council to endorse the Renfrew County and Area, Virtual Triage and Assessment Center, and that it be distributed to all of the lower tier municipalities, perhaps Roma et al. Is that appropriate then, Mr. Morrow? And the specific wording we're not going to get hung up on today. That will be part of the report delivered to council.
Yes, sir.
Right.
Absolutely. Thank you.
Thank you. With that, then I'm going to go to Councillor Murphy, then Love, then Reguer. Then Lafreniere. Councillor Murphy.
I would move that resolution. All
right. Thank you. Councillor Love.
And I was going to second it.
All right. Thank you. I assumed perhaps they were questions or comments. Councillor Lafreniere.
Thank you. I would hope that you could mirror that resolution's text and have us present it to the City of Pembroke Council as well to endorse that resolution and send it on as well, as we are obviously affected greatly. You know, although we're a slightly heavier populated landmass, we have the same problems. I mean, I'm very certain that my doctor's going to retire shortly, and I have an aging mother who doesn't have a doctor. So if you could ensure that that is forwarded to city staff as well, I would appreciate it.
Point well taken, Councillor Lafreniere. And I think perhaps having made that, Mr. Morrow, I'm fairly certain that Mayor Dumas in South Algonquin also would be an appropriate, the Council for the Township of South Algonquin would also be an appropriate distribution for endorsement, as they are certainly within the catchment area of the health services in Renfrew County and area. Warden Robinson.
Thank you, Chair. I just want to make sure that everyone is clear that when I talk about the physician shortage in Renfrew County, that includes the City of Pembroke.
Yeah, and I've seen the numbers that you've been posting, Warden Robinson. I'm assuming that the 107,000 figure is probably also incorporating some slight bubbles that would extend beyond the geopolitical boundary of the county of Renfrew as well, both to the east and likely to the north and south, frankly. So I think that we've pretty much done that to death. Any further comments on the resolution in front of us? Councillor Doncaster.
Thank you, Mr. Chair. I just wanted to make the point that presumably if County Council passes that resolution, that all of the background information that we have had at committee is also forwarded on to all of the municipalities.
Thank you, Councillor Doncaster. I think that's enormously helpful and appropriate, because I think there is perhaps in the background to that resolution coming forward from committee that there be substantial data that we have available that we put it into a very concise form, demonstrating the incredible need for this service. Anything further on the motion itself? With that, then, all in favor? That is carried. Thank you very much. Just my final comment on this. I want to move along very quickly now. To me, there is a recurring theme throughout Chief Nolan's report, and in fact, it extends into Ms. Sheedy's report as well. So much of health now demands a collaborative effort, whether it is the homelessness situation, whether it is mental health, whether it is the Sierra team responding along with SARS, along with the OPP. All of these things are demonstrating that there is no one single answer to all of these problems. And I think more and more it's being demonstrated through COVID also that COVID itself is very asymmetrical, that the enormity of the damage has been both in long-term care and in the large urban centers, and I'm very sensitive to that. I think that it's vital that we continue to advance the critical issues of health in particular. Second to that is broadband within our community, but I think that this is going to require a concerted effort of all involved to ensure the health and well-being of, frankly, our woefully underserviced area here, and largely, I'm sure, shared across rural Ontario, if not rural Canada. With that, then, moving on to item number 3, the community paramedic palliative care. Again, speaking about the Swiss Army knife of paramedic services. Okay, nothing on that. Item number 4, community paramedicine, community of practice. Item 5, the paramedic service leadership team staffing changes. Councillor Murphy.
Just a comment. Thank you, Mr. Chair. There's actually an article about Amber in today's Eganville Leader. I haven't had an opportunity to read the article, but lovely picture of her, and I'm sure it certainly does her new position proud. So I'm looking forward to reading that if others pick up the Eganville Leader or get it online today.
Thank you very much for the heads up on that, Councillor Murphy. Absolutely. Anything further? I'm just going to take this opportunity to thank, certainly to congratulate both Deputy Chief Grenier, who has been in an acting capacity for some time now, but also Commander Holtink, who I understand has also been in an acting capacity for quite some time. Well-earned, well-deserved, outstanding individuals. I also want to acknowledge Michelle Rouet, the departing at the end of this month, as Chief Nolan has identified, the departing Deputy Chief for his outstanding service to the paramedic service of the County of Renfrew, but certainly, of course, to all of the citizens. And again, as the Warden has indicated, when I say that, I'm speaking of the geographic county, Mayors LeMay and Councillor Refrenier, of course, the outstanding effort that has been put forward by Rouet. At the same time, I think in the COVID, some of the positions that we've been backfilling, it's akin to Michael Corleone's line that once you get out, you don't really ever fully escape, because I know several of our retired paramedics have come back into the fold to provide a great deal of service in our response to COVID. So an enormous thank you to all of those as well. With that, then, moving on, letters of gratitude. The interagency collaboration. I'm just going to not expand, but just repeat. I think that this Sierra team demonstrates again, given the nature of our economy, the importance of tourism to our economy, our geographic location adjacent to, in fact, surrounding, I suppose, from the south through the east and onto the north, Algonquin Park. We are the natural playground for Ontario and the country, and perhaps even a large part of the world. That in order for those who are availing themselves of the supernatural beauty of Renfrew County and Algonquin Park, I think it's vitally important that we have this kind of collaborative effort. The muscle memory from substantial training and communications between all of these agencies is what demonstrates the seamlessness. It takes a lot of work to make something look quite easy. So thank you to the Sierra team on this. The that was interagency collaboration. The CSSP case study. Again, once again, demonstrating the collaborative approach to delivering health and social support in Renfrew County. Item 9, the research for the VTAC. And finally, item 10, the treasurer's report. I see none. I want to thank Chief Nolan for bringing it up. It certainly was one of the notes that I had in front of me. Was this is about the third time I think I've highlighted the discrepancy on the salary line items, that we are essentially 37% under budget on admin and 20% over budget on paramedic salaries. I have no doubt that the paramedic salaries will certainly be related to the COVID response, but I'm pleased that you once again highlighted that the underspend on the admin side is in all likelihood driven from those paramedics that by times are in an acting capacity as commander. I wonder if I see Mr. Foss is on there. As I said, I think this is the third time that I've highlighted that, and was going to ask, had Chief Nolan not brought it forward, is there some means that that can be corrected? Ultimately, that 40% or 37% underspend on admin is certainly leaving the impression that we are over budgeting on admin. Is there some means of adjusting how we are allocating specific times, even when non-full-time people are filling the commander roles, et cetera?
Thank you, Chair, for the question. And in response, all of the posting to the general ledger for the salary accounts are, of course, driven by our payroll system. And the payroll system, in essence, is driven by the inputs that we receive for the payroll system. So those individuals that have been identified in an acting capacity, their payroll information continues to come to the payroll office using their former positions, which would have been in a frontline paramedic capacity. So, and it's really an easy fix for us, is when those earnings are sent through to payroll, we simply record those within the admin department on their payroll input, as opposed to the paramedic frontline worker department. We can, as Chief Nolan has suggested, we can at any particular point in time do a journal entry to recognize the salaries that are posted into the in the frontline departments incorrectly, and move those over to the admin departments. But that, in essence, is the process that we have. It's the same for all departments across the county. So we rely on each one of our scheduling departments to provide that information for us, and that's how payroll is posted. Hope that answers the question.
I think I understood that it can be done. Is there some particular coding that has to be done when the payroll information is presented to the payroll department from the various departments?
Yeah, we have, in response, Chair, we probably have 100 different departments that we're operating within our payroll system. Each one of them is connected to a different general ledger account. So it's really just a matter of using the proper department at the time of capturing and coding the payroll. And then when that data is sent through to the payroll office on a biweekly basis, it's automatically charged to the appropriate department. So that, in effect, is how we cure the problem on a go-forward basis. Retroactively, it needs to be done through a manual calculation and journal entry process. So what we would need is to understand the magnitude of how many individuals have been coded to frontline paramedics as opposed to admin, and then we can certainly make a correction via journal entry.
All right, thank you, Mr. Foss. And I'm assuming that that can be taken offline, certainly between, in this particular instance, between yourself and Chief Nolan. From my perspective and on behalf of the committee, from an oversight perspective, it would be much clearer if that was incorporated into the treasurer's report rather than highlighted and brought forward as a question each time that we're seeing it. Thank you. Anything further on the treasurer's report? I see nothing. Can I have a motion to adopt the treasurer's report then, please? Councillor Brill, seconded by Councillor Bennett. I believe I saw your hand. Anything further once more around? All in favor? Thank you. The emergency services report is adopted. With that then, Ms. Sheedy, we'll pass the floor to you for the long-term care report. Actually, just before we do, does anyone need a moment? Okay, I think we'll carry on then. Ms. Sheedy, please.
Thank you very much, Mr. Chair. Good morning, Health Committee. The long-term care report starts on page 34 of your package. Items number 1 and 2 are the resident statistics for each of Bonnechere Manor and Miramichi Lodge as of the end of July. Just the asterisk on the top of the next page. You will recall that through COVID and consistent with the provincial directive, we are not accepting respite admissions at this time. So you'll continue to see that occupancy be quite low for the year 2020. Item number 3 is the wait list for the 9 long-term care homes in Renfrew County as of the end of June. Item number 4 is the update on COVID. So starting with our symptomatic testing, as we've reminded you, the range in symptoms for the elderly is very, very broad, meaning that we are regularly testing our residents for one reason or another. As of this morning, we have 1 resident at the manor that we're waiting for that swab result to come back. So again, that means that resident is considered in suspect COVID, and that puts the home into a suspect outbreak case. It no longer means that that's a reason to hold on admissions. However, with respect to that particular resident, that means he or she is isolated in their room. They're not permitted to come out to the dining room, and any interactions with staff include full PPE, gowns, gloves, eye protection, and of course, masks. The only family visitors that would be permitted would be what are considered essential at the end of life. The lodge has 0 as of this morning rather. And then in terms of surveillance testing, we are back to testing staff twice per month. There was a little bit of a lag. We finished May and June doing it twice. There was no direction for the month of July until about 3/4 through the month. So we were able to fit in 1 test for that month, which was okayed by the ministry for all long-term care homes. And then for the month of August, we're back to doing it twice. So we finished the first round. As I was explaining to the EOC, we will, as long as this requirement is there, have large numbers of test results pending at any particular time because we're on a every 2-week cycle. So just to give you an example, as of this morning, we were waiting for 82 staff surveillance results and 197 Miramichi Lodge. So it's not uncommon to have, upwards of 300 or 400 at a time. The next bullet point is with respect to funding. So we received the one-time funding allocation for June. Committee will recall we received funding allocation for April and May, 37.5 for each home. Then a larger amount in May, which captured if the home had experienced an outbreak prior to that. And so Miramichi Lodge fit into that category with the staff response. And then now for the month of June, Bonnechere Manor does as well. And the ministry has indicated that once you have experience, unless they change this at this current time, they're telling us that once you have had a positive staff case or positive case of any type, you will continue to get that additional funding. So for the manor in the month of June, 112,000, and for the lodge, 105,000. And again, just the difference in numbers of beds accounts for the difference in those funding amounts. In terms of advocacy, there's a lot of work going on to try to capture the lessons that we've learned to date, in particular in advance of the second wave. I have been involved in a number of working groups through Advantage Ontario, so it represents the municipal stakeholders across the province. And then there's a number of groups as well looking at the emotional care and how, you know, particularly with the restrictions on family visitors, what that has meant for residents. And I will be presenting at an Advantage Ontario webinar to my colleagues in long-term care across the province on August 20th on this topic. We have more details released with respect to the commission. I won't read the entire paragraph there, but while certainly the three nominees are very qualified, we were disappointed to see there was no long-term care expert on the panel. And I think this is very symbolic of how long-term care is treated in the healthcare sector. The piece of good news, though, is the ministry has indicated that while the report is going to be due to them in April, they are not going to wait until April to make some changes. So that has us cautiously optimistic. In terms of family visits, since our last meeting in June, mid-July, we had direction from the province about a slight change in the outdoor visits, and it was that the family visitors are no longer required to be tested for COVID. They still have to wear their own cloth mask. And also the number of visitors per visit was increased from 1 to 2. The other big piece of news that was effective as of July 22nd is we could start to open up to indoor family visits. So there is a requirement for families to attest to having a negative COVID swab within the previous 2 weeks of the date of that visit. As well, there 2 family visitors are permitted per visit, per resident at a time, and the home is required to provide a surgical mask to those visitors. Interestingly, though, the ministry was very quick to say that we should avoid accessing the provincial pandemic stockpile for this purpose. The requirement is still that visitors have to maintain physical distancing. So to ensure that we meet all of those directives and really in recognition of the fact that we were almost half a year, over 5 months, with family visitors not being in the home, we certainly didn't want to go from a pre-COVID status to, you know, just opening the doors and business as usual, because it, you know, it certainly is not. So we did continue to exercise a very cautious approach. And I did discuss this with my colleagues in Renfrew County and the municipal colleagues across the province. I can't say there was 100% consistency, but certainly the majority took the same approach as we did, which was to designate a visiting area so that we're able to ensure that we teach the family members everything they need to know in terms of donning and doffing the surgical mask. It is a high risk exercise in terms of communicating COVID. And making sure the physical distancing was maintained, et cetera, et cetera. So we're very cognizant that for residents and families, in some ways, it's almost created more angst. I think the announcement was received by most residents and families with finally, we're going to be back to the way it was, and we're certainly not there. And so, you know, as I said, in some ways, it almost, the anticipation made it worse. Yeah, I'm sure it doesn't feel very home-like to have a visit in a designated spot, not in the resident's room, and staff to be supervising in some way. The staff member doesn't sit there as part of the visit, but they're certainly monitoring it to make sure that those rules are being upheld. So definitely a crawl, walk, run approach. We're into our third week now of doing visits in that way. And so I've indicated to residents and families that we are taking a look at how can we make it more normal, more home-like, but still meet the intent of the directives. So we're just doing consultation right now with our joint occupational health and safety committees and other stakeholders. And I am optimistic we'll be able to make it more home-like going forward. But again, you know, in that crawl, walk, run analogy, we may be at the walk stage, and who knows when we would ever get back to normal. The next bullet point is with respect to lessons learned in long-term care. And Mr. Morrow has passed on to me a number of resolutions and information from other municipalities. They're found in Appendix 1 of your package on page 48. Since we were informed a few weeks ago that we will have a delegation with Minister Fullerton, we very quickly put together a draft presentation for the warden, and that is attached on Appendix 2 of your package, page 56. It is not formatted yet, so that is yet to happen. But we have had some feedback from the CAO, and he's recommending that we include some information about the senior strategy, so that will be done. So when the chair goes through this report, if anybody else has any other comments that should be included, recognizing that the warden will only have 15 minutes to overview long-term care. And we certainly want to highlight VTAC for all the reasons that was discussed in Chief Nolan's report. So we'll perhaps a further discussion on that in a few moments. The next bullet point and last one under the COVID update is the preparation for the second wave. And so the province has asked all long-term care homes across the province to provide back information to them in the form of a framework that they provided to us. Most of that information is in your package under those bullet points. And they're really, as you can imagine, trying to anticipate where homes are at and where, you know, the challenges might be. And we've gone through this exercise in both of our long-term care homes. And I feel confident that we are in a good place in terms of preparation for a second wave, except for the following two areas. Staffing challenges remain, you know, as we've heard through all the commissions and inquiries, that staffing was a challenge pre-COVID. None of us should be surprised that it's a challenge during COVID. We have staff off for a number of reasons that may or may not be COVID related. Just to give you a sense, I have 16 staff, nursing staff on maternity leave right now. Very difficult to replace for a fixed term when it's not a permanent position. So, you know, just to give you a snapshot. And then, you know, we, as I indicated earlier and previously, we inevitably have suspect COVID cases at any given time. And we are cohorting our staffing. That means that staff is designated to look after that resident only until we get that negative, knocking on wood, swab back. So, you know, huge draws on our staffing resources. And then the other one, PPE, consistent with what Chief Nolan has said, you know, it ebbs and flows. We're definitely in a better place than we were, you know, at Easter when the warden wrote that correspondence to the minister. But, you know, as we have increased family presence now in our home and having to supply surgical masks for them, you know, it is a concern, and we're certainly keeping a close eye on it. My recommendation to the province is that they should be procuring it so that we are not price gouged, and they should be distributing it equitably across the province. Quite frankly, Staff in the long-term care homes, I can't speak for the other sectors, they do not have time when we're knee-deep in a pandemic to be doing this. Interestingly, for a number of the smaller sectors like family health teams, for example, the province has now taken on that responsibility to find the PPE and to provide it to those smaller organizations directly. Hospitals and long-term care at this current time are not currently included in that group, and that will be part of our pitch to the minister at our delegation. Okay, so moving on to more business as normal, and I guess I want to preface this with it's really difficult to go on with business as normal. It's necessary, no doubt, but I'll just use the example that I gave earlier about the staff testing. We're testing upwards of 500 people every second week. So you can imagine the organization and the coordination that's going on in each home with that regard. That's but one activity that's COVID related that, we're still operating long-term care 24/7. So the ministry has advised us of some reassignments, and the information is in the link provided in the package. Item number 6. So there was a flurry of long-term care announcements over the month of July. With respect to funding. So I will do my best to walk you through this, and I'm very pleased to see Mr. Foss is on the call, so I know he will help me out as needed. So starting with our level of care increment, committee will recall that we're funded through 4 separate envelopes. They're listed under number 6 there: nursing and personal care, programs and support services, which is client programs, recreation and rehab, raw food, which is self-explanatory, and then other accommodation, which is everything else. So it's the food services, everything but raw food, and then housekeeping, maintenance, laundry, general admin. I feel like I'm missing something. Housekeeping, maintenance, laundry, food services, admin. So the 3 last envelopes, everything but nursing and personal care, the per diem we receive from the ministry is the same across the border. So whether it's a long-term care home in downtown Toronto or Bonnechere Manor in Renfrew, every home receives that same per diem. The only difference is the nursing and personal care, and that's based on the CMI, and you're very familiar with our concerns with the CMI. And so the average is a little more than $100. And so our per diem is an increase of $2.08, but that's going to be individualized with each long-term care home based on what your CMI or your acuity of care actually is. So we'll just hold that thought. Then we also received through the ministry an increase in what they're calling a global increase, and you see those amounts on the bottom of item number 6. And then moving into the CMI funding itself, I'll walk you through that table. So the first column is what we were funded at last year. And you will recall that our concerns that certainly our chair has very eloquently expressed is that it's a bit of a farce. I think you called it farcical, because it doesn't matter what our acuity actually is. The pot of money is fixed and it gets divvied out amongst the 600 plus homes in the province. And your care needs have increased. You might get an increase in funding, you might not. So last year, Bonnechere Manor was funded at 0.98. Miramichi Lodge was funded at 1.04. What we budgeted for 2020, and again, it typically starts April 1st for the last 25 years. CMI has ended March 30th based on the provincial fiscal year and started April 1st. What we budgeted in 2020 for Bonnechere Manor was 0.99. So we knew for our own internal CMI results that we anticipated it to go up slightly. We are ultra conservative because we've been burned before because of this re-indexing. We've been spot on what our actual CMI is, but what we get funded is a whole other story. So the Manor budgeted 0.99, Miramichi Lodge budgeted 1.04. What the ministry has acknowledged our actual CMI, the acuity of our care, starting April 1st at each of our homes. Bonashire Manor went up to 1.07, so that's a significant increase. The Lodge also went up 1.04 to 1.13, also significant. However, it's the third column that is the reality that we face. This is what we're getting funded at. You know, regardless of what I've just told you, Bonashire Manor will be funded at just slightly over 1, despite the fact our acuity is 1.07, and Miramichi Lodge will be funded at 1.05, just slightly over last year, but much less than what it actually is at 1.13. Okay, so the next table is a lot of information, and I know our chair had some questions on it. So it's tried to, the purpose of the table was try to indicate to you as clearly as possible, here's what we budgeted, here's what we now know as of July, and so this is the impact that it will have on our budget. So under the, I've already gone over the CMI line. The second line row is the quality premium. And so what is that? So it used to be called accreditation, and in our old treasurer's reports, former treasurer's reports for 2019, 2018, et cetera, you would see a line there for accreditation funding. And that's what the ministry would fund us on a per diem basis if we were successfully accredited. They now call it the QA premium, and it's actually rolled into the other accommodation envelope, which I've referred to earlier, known as OA. So what happened when we did our budget for 2020, because this is the first time that it's rolled into the other accommodation envelope, is we budgeted as a revenue both in other accommodation and under the QA line in provincial revenue. So it's been budgeted twice. So that's why you see that minus in red for each home. That's the identification of that error, and we'll carry that forward for the rest of this budget year. Then you see the global increase and the totals there. There is the notation that the CMI starts on August 1st, which is a difference from, you know, history, certainly over the last 25 years. And also, as our chair has pointed out, however, the global increase is backdated to April the 1st. Okay, so moving on to our minor capital program, committee will recall that we did receive something called a structural compliance premium for those homes that were older than Miramichi Lodge, for example, because the Lodge was still receiving some construction funding subsidy, and we will do that until 2024. The ministry had indicated, you'll recall, soon after they came to govern, that they were eliminating this funding entirely. There was incredible pushback, including from this council. And so they decided that they would continue to fund it, but it was going to look different. And so we now have details on what that is. And so I'm hopeful that the table below will explain that to you. So in the year 2020, prior, under the old program called the structural compliance, Bonashire Manor received $197,000 per year. And again, Miramichi Lodge was not eligible for it, but the Lodge got funding in a different pot. Then the ministry has indicated that over the next subsequent 3 years, I believe that is, we will see that fund decrease. And then at the end of 2024, they will consider it fully phased in, and all homes will receive a $5,000 base allocation and then a $1.42 per diem amount. So for Bonashire Manor as a 180 bed home, that will mean we would receive $98,294 going forward after 2024. And this is almost 50% less than the previous capital funding. So disappointing, especially, I'm going to state the obvious. Homes like the Manor that are already 25 years old are going to be 30 years old and then 35 years old. So our capital costs are only going to increase. And then interestingly, as you know, there's been a lot of media attention to the state of air conditioning in long-term care homes. Not unique to this summer. It hit the front pages, I know, of the Citizen and the Star last year and the year before. So despite what this government may feign as this being a surprise to them that long-term care homes are not air conditioned by regulation and by practice, that's been fully known for at least the last 3 years. So I wanted to give you a little bit of an update on our two homes because I thought you might be questioning that. So with respect to Bonashire Manor, it's 25 years old, and consequently our system is 25 years old. In my non-technical opinion, I believe the system was undersized from day one. Or it certainly reached the end of its useful life because it just cannot keep up. And I can tell you that this summer, currently, and certainly last summer, it's uncomfortable for residents and staff alike. For that reason, you, committee and council, through our budget process, approved, first of all, an engineering study on our HVAC system. What's wrong with it? What do we need to bring it up to make sure that it does meet resident and staff needs going forward? That was done at a cost of over $1.5 million. So, when you look at this capital funding that the ministry is providing to us, not only is it not enough, it's important that you realize that different than the previous funding where if we didn't use it, it would be considered a surplus in our budget and go back into our capital plan for subsequent years. That is not the case with this new funding. It is going to be reconciled at the end of each ministry budget year. And if we don't use it all, we will be paying it back to the ministry. So it means that when you have these big projects like HVAC systems, like roofing, you can't save up for them, which is really, really unfortunate. So I wanted to let you know that we made some changes, some enhancements to the HVAC system, the cooling portion of it in year one at Bonashire Manor last year, again approved by you through the budget process. You approved the plan for year two, delayed in getting started related to COVID, but also some of the equipment that is required to be updated is still in production. So we wouldn't have been able to start anyways. And then the other factor in our decision to postpone it until this fall is that in order to have the work done, we would have to turn our HVAC system off, our cooling system off. And while it's not satisfactory, it's better than nothing. And so, given the heat of July and August to date, there was no way we could do that. So we will be starting that work in the fall and hoping to conclude it in our budget, subject to your approval, in the budget year 2021. Miramichi Lodge is a different story. It's only a 15-year old facility. The HVAC system was properly sized. While the resident rooms aren't considered air conditioning per se, but more tempered air. And I'm not sure if our new administration supervisor that I'm going to introduce in a few moments has joined us yet, but he is hoping to join us. And if you have any further questions on that, if he's not here today, I definitely will answer those at a later point. But suffice it to say that residents and staff find it quite comfortable. Yes, you know, when you're doing multiple baths a day, or you're working in a busy kitchen that's got multiple dishwashers going, industrial dishwashers going, is it hot? Yeah, but it's warm in the middle of January too. So I think the building is the best that it could be. And certainly the technology is up to date and it is comfortable. Item number 9, deferral of the long-term care accommodation rate changes. Committee will recall that each year the ministry tells us what the residents will pay for their rent portion to live in long-term care. Again, it's the same across the province. This year, they had indicated earlier on that they were going to defer them. We've had new information. Those increases are going to be deferred right until January the 1st. The preferred accommodation is the only area where the home gets to realize any increases. Any increases to the other types of accommodations, basic or shared, are offset by the global increase. So if the ministry increases it for the resident, they decrease the funding they give to us. So it's only the preferred accommodation that we see. And the link is there for the, as Mr. Beakley would say, dog's breakfast of all the different rates, depending on not only the type of room, but the date of your admission, because that changes the accommodation rate. Okay, item number 10 is information only. We're certainly not at the stage of looking at redeveloping either of our homes or adding on beds at this point in time. But again, there's been significant media attention and stakeholder attention to the fact that the B&C homes have known that they were out of date for over 20 years. In 1999, the province went around and classified every home in the province as A, B, C, or D. The old lodge was a D. Many homes in the system are B's and C's. The 2 homes that you operate through the County of Renfrew are both considered A homes. So we have B and C homes. Those B and C homes still have ward rooms. That means 3 and 4 people sharing a bedroom. Huge infection control concerns and air conditioning that we've just talked about. So it's resurrected this issue, and that the process to get new beds approved and actually built is very slow. And so the government has taken a couple of approaches: one, to speed up the paperwork administration side of it, but 2, to update the funding model, because clearly homes, B and C homes, were dragging their feet because they simply couldn't afford it. And so I won't go into a lot of detail there, but just to say that they have changed their funding approach depending on the type of home and the type of geography that home is in, whether that's urban or rural, etc. Item number 11 is the Gillies public inquiry. So we have a number of reports. They're on page 58 of your package. Please pay particular attention to the staffing report. Those are calls that many stakeholders across the system have been asking for more than 20 years. Again, no surprises here. Very well aligned with our position paper that the warden will be presenting to Minister Fullerton in a week or so. Item number 12 is Advantage Ontario and how COVID has impacted it. Of course, the convention and the AGM were canceled. The AGM was rescheduled this morning through Zoom, and that went off very smoothly, and was the reason for my late joining you. And then the conference, or the education portion of it, what they've done is that for the topics that were most highly, what's the right word? Sorry, I'm just drawing a blank. They were most popular. Thank you. They have made them available to the sector through Zoom. So yesterday I did one on our PSW partnership with Algonquin College, and on August 20th I will be doing one on emotional-based care models. and how we continue with that in the face of COVID. Item number 13 is a seniors housing strategy update. There's the background information on the budget approval and the RFP approval. And then just a reminder that we're looking at the whole gamut, not strictly bricks and mortar, but everything from the care component, and certainly VTAC could be a huge opportunity in this. And I would say that middle paragraph with those 4 bullet points will be added to the warden's presentation to the minister at our AMO delegation. But the next area gives you an update since the RFP was approved. There's been a lot of work happen despite being in the middle of COVID. And I really, really thank the rest of the County of Renfrew team for all the work they've done on this, in particular, Mr. Kelly. So Mr. Morrow, Mr. Kelly, Ms. Lapine, and myself meet with the consultants on a weekly basis to keep this work going forward. It is a very tight time frame. And so, as you will know now, because you have all been identified as a key informant related to your leadership role within the community, and also for the fact that the 18 municipalities that make up Renfrew County are all geographically obviously placed so that you do represent the geography of Renfrew County. And so I'm hoping you've all received your questionnaire and you will be able to respond back to the consultants directly by that August 15th timeline. In addition to that, we've given them a huge number of community contacts of everything seniors and or housing related for them to touch base with, either through a community forum or a focus group. So that's happening as we speak. As well, the consultants have developed a background document for anybody that is participating in the input collection. As well, we've developed a media release, and both of those are in your package, page 60 for the media release and page 62 for the backgrounders. So there is a designated email address that if anybody in the community, other than those identified people I've just gone through, want to give feedback, they're certainly encouraged to do that, and that will be passed on to the consultants. So I think we're taking a very comprehensive approach. Item number 14 is the treasurer's report that Rhonda sent out to you in a separate email. Again, as recent as the end of June, and we only saw that at the end of last week ourselves. So I will do my best to overview. I know the chair had a few questions, so I will do my best to try to address those as we go through those 2 reports. So we'll start with the Bonnechere Manor report. Sorry if I shuffle my papers here. Okay, I will point out to you what I think is of significance. And then again, if you have any questions as we go through the report, I'd be happy to answer those. So with respect to nursing and the salaries, to note that we have received 75% of the pandemic pay, that $4 an hour in those lump sums for those months that the government announced in April, but did not flow until the end of June. And as recently as last week, I was still getting FAQs from the Ministry of Long-Term Care in terms of how that who's eligible and how that should be paid out. So at the senior staff level, we made the decision we were not going to pay it out until mid-August, and that was consistent with our labor group's request for a separate check. So it wasn't the every 2-week payroll check that they typically get. The expense is not included in any of the salary lines of the various departments. In terms of the COVID line, yes, that is an unbudgeted line, obviously. It includes in every department. It varies depending on the department. Some things are consistent. PPE, for example, some departments use more than others. Obviously, nursing would use the most. But there are some unique things like, so for example, we've had increased staffing and supply costs under housekeeping because we're doing more cleaning, more high touch areas, doorknobs, light switches, etc. And so I think that covers the majority of what I wanted to say that I would want to preface under Bonnechere Manor. And then to address a question that our chair had under expenses, if you want to turn to that, it's page 5 of the Bonnechere Manor Treasurer's Report under grants and subsidies. I'll just wait a moment if people are turning to that. The very last line under grants and subsidies is called one-time funding. So far, as I've indicated, related to COVID, we've had a one-time COVID funding in the month of April and May of $37,500 each. Then in May, we got a payment. You'll recall the lodge was $88,000. The manor, I think it was around $48,000 because the outbreak of the manor hadn't been captured yet. So those, and then the pandemic pay, again, we have 75% of it. The other 25% has not been flowed yet. So those were the things I wanted to point out in the manor report. In terms of the lodge report, it's really basically the same. I guess I could probably go into a little bit more detail and give you some ideas of what are the expenses in the COVID funding. As I said already, PPE is obvious. There are disposable items like even paper plates and those kinds of things, which we use when somebody's on contact precautions and for other things related to COVID. We've had to invest in a huge number of thermometers because we're testing everybody, residents and staff, twice a day. I've already mentioned the housekeeping, just disinfectants like the wipes and the actual liquid disinfectants. Laundry, we've had to buy more non-disposable laundry products. We're going through more supply costs that way. Under building and property, we've added plexiglass pretty much anywhere you can. So for example, where there's screener, where the person, before they are allowed into the home, we screen. Again, whether it's staff or visitors, plexiglass. The residents' dining room tables, in order to maintain the 2-meter distance, we've had to spread out everybody at the tables and spread out the tables themselves. But we also, so for example, if we had a table for 4, it's now a table for 2, but we have plexiglass in between them and the person that they're sitting directly across from, because obviously residents are not wearing masks while they're eating. The costs of Zoom under administration, screening, both staff and the screening costs, just gives you some idea of what those COVID costs to date are. And again, they would be as of the end of June. So going back to my report, we are at a bargaining update on item number 15 in the report. So committee will recall we already started bargaining with Miramichi Lodge, where it was not successful with that, including conciliation. So we are off to arbitration with them, no dates yet. We started bargaining with the manor. I had originally scheduled it, but had to postpone it related to COVID. So that first date happened on July 29th. Our team is led by Mr. Beakley, and it includes Sandra Block, the administration supervisor, Tricia Michaelis, a resident care coordinator, and Dave Norton, our environmental services supervisor, as well as myself. Very disappointed to tell you that these talks broke off as well. And that at the conclusion of our day, well, quite frankly, well, no, I'll save it for closed. Sorry, I will go into further detail in closed about this. But suffice it to say, those talks broke off and CUPE indicated they were filing for conciliation. That has been done and we don't have a date for it. And so stay tuned on that. And again, I will give you more information on how far apart our two proposals were enclosed. Item number 16 and 17 are both capital projects that we would typically have come through you and County Council for approval, but because of COVID and the delegated authority, the warden and the CAO have approved that, so they are in this report as information items for you. The first one is the roof replacement. This is an ongoing project at Bonisher Manor. You did approve the dollar amount previously through the budget process, and it is within that dollar amount. The next one is the HVAC system. Again, you approved $285,000 through the budget process. However, the lowest bidder, who did meet the intent of the RFP, but just on the cost issue alone was over what was approved. And so we do have an engineer that we are working with through this ongoing project. And so he's working with Mr. Norton to scale the project back to the budgeted amount. And then we'll come back to you through the budget process in 2021 for what is hopefully the final phase of this project. Item number 18 is information on an inspection from Bonisher Manor. There have been inspections ongoing off-site virtually, but you'll see there was a combination of the inspector coming on-site on some of the dates at Bonisher Manor. The first one was related to a complaint, and I'm pleased to advise you that there were no issues related to that. The second one was a self-reported critical incident on our part, and it was related to medication errors. And we received a written notification with a voluntary plan of correction that's already been done. And we were well and continue to be in the process of working with the employee involved in trying to reduce the risk of further errors. Item 19 are Renfrew County and District Health Unit Renfrew County and District Public Health Unit inspections. As you know, they come in on a regular basis to inspect our main kitchen as well as the serveries on each of the units. And then as it relates to COVID, they've now done 2 inspections specifically related to our infection prevention and control protocols to ensure they are consistent with the provincial directives. So very pleased to say that on the kitchen inspections at the manor, there were no issues of non-compliance. At the lodge, there was an issue related to an item that needed to be cleaned. That happened immediately after following that inspection, and so we're in a good state there as well. And then in terms of the infection prevention and control as it relates to COVID, Bonisher Manor had no issues. They were full of praise. The manor, similarly full of praise. They did remark that they had observed on a couple of occasions where staff in the provision of their care, the mask slides down and it has to cover your nose and your mouth. And I know myself, I'm constantly, we're not supposed to touch it, but it does slide down because surgical masks are a one size fits all, which is one of the key differences between it and an N95 mask. So that's going to happen, and they observed it, and we have reminded our staff to make sure that it is completely covering nose and mouth at all times. Item number 6 is information on funding. Mixed up here on my report. Item number 20 is where we are at, and that is to advise you of a new environmental services supervisor at Miramichi Lodge. And Rhonda, is Mr. Keller? Yes, he's on the call. Okay, so Ari, if you're able to turn your video on That would be wonderful. In the meantime, I will introduce, first of all, to let you know, Mr. Daryl Berger retired from Miramichi Lodge after 8 years with us. He left just before July 1st, and he's relocating to the province of Alberta. Very pleased to introduce Mr. Eric Keller to committee, who has taken on this new position. Again, environmental services at the home includes housekeeping, maintenance, and laundry. It is a big department, and we're very pleased that Mr. Keller brings a very strong background in facility maintenance. Of course, our buildings are very big. I know, as a matter of fact, the lodge is over 140,000 square feet. Remember that from my redevelopment days. I'm sure you will want to join me in welcoming Mr. Keller. As you know, as part of orientation for any of our senior management team, we also always ask them to participate in a health committee meeting, and also ideally the subsequent county council report, so they can get an appreciation of who our board is, who I report to, and the process at the municipal government level. Item number 21 are expressions of gratitude for each of Bonisher Manor on page 64 and the Lodge on page 65. If we do include resident names, it's because the resident and or the family member has given us express permission to do that. So please be assured that that's always in place. Item number 22 is an update on fundraising. Obviously, very challenging in COVID times, but hats off to our foundations and our coordinator, Lainey Bolt Johnson, for no shortage of creative ideas. So we've got our butterfly fundraiser that is ongoing. More information on that is in page 66 of your package, but it's an opportunity for us to fund the physical environmental changes we're going to have to make at each of our homes to be more butterfly-like. Similarly to the Lodge in the month of May, you'll recall in the month of June, residents and families in the community participated in a virtual walk across Canada for the Lodge. And very happy to advise you, and this was consistent with Seniors Month, so it was very nice timing, that the Lodge raised over $5,000. So great job there. Early in July, we were informed by No Frills that they had selected us as Bonisher Manor Foundation, that is, as their fundraiser for 2 weeks during the month of July. This is the second time that they've done that in the 4 years that I've been physically at Bonisher Manor. I don't have the total number of dollars raised yet, but we'll certainly bring that information back to you when we do have it. In addition, in the month of July, I accepted a check from the Renfrew Legion, for a little over $8,000, and that was specifically through our big replacement of 100% of our beds, which we were able to do finished out in the year 2019. And then finally, as both of our galas were obviously canceled this year, and they are a major fundraising event for each of the homes, we've come up with the idea of doing a virtual gala-like event. I see other organizations are now doing the same thing. So like all fundraising, it's a difficult market out there. But ours is going to happen on Friday, October the 16th. We're calling it a coffee house to connote that it's more of a relaxed, people aren't going to be dressing up in gowns and tuxedos since it's going to be happening in your own homes. We want people to be relaxed, but what we will replicate that's similar to the gala is we will have food available that by the purchase of your ticket will get you this food that you will have to pick up either in Pembroke or Renfrew. And we will have local entertainment and we will have silent auction items. So we're trying to replicate it as much as we can. At this point, we have a save the date, but more information to come on that. And that, Mr. Chair, concludes my report. Thank you.
Thank you very much, Ms. Sheedy. A very lengthy and involved report, and you got through it very well. Thank you. With that then, I'm going to go back to information item number 1, the Bonnechere Manor resident statistics, and invite any question, comment. Item number 2, Miramichi Lodge resident statistics. Item 3, the Champlain Integration Home and Community Care waitlist. Item 4, the COVID-19 pandemic update. A lot of bullets to get through here. I do want to, I made note on my report here, I do want to note and commend Ms. Sheedy, well-deserved. And I'm quite thankful that she has been invited to participate in several forums and make presentations. I think that much to provide to the long-term care industry in the province. So thank you very much for that, Ms. Sheedy. The item 5, the long-term care staff reassignments. I'm actually encouraged in this that there is an expansion to the structure of long-term care. In my mind, this solidifies the appropriate decision of the Ford government to recognize long-term care as a separate issue and element within health, of course, but I think also we're going to get there with respect to the commission. And I echo Ms. Sheedy's comments that it is terribly unfortunate, and I would suggest even unacceptable, that there was not a seasoned long-term care veteran was appointed to this commission. So there is still much ground to cover until we solidify the appropriate nature of recognizing that long-term care is an integral part of the healthcare system. Item 6, the long-term care funding. Item 7, the case mix index funding. And I will certainly repeat, as noted by Ms. Sheedy, this is essentially a charade as everyone's acuity probably across the province is increasing. Everyone remains static, and it is a status quo. It is not in any event recognizing the dramatically increasing acuity. I think the last I heard from you, Ms. Sheedy, was I think 80% now of long-term care residents have at least some element of dementia as part of their care program. I do see Councillor Murphy, you have a question.
Thank you, Mr. Chair. I wasn't sure my my internet just came up. Internet is unstable, so thank you for recognizing me. I'm gonna turn this to Shelley. How many times do we have to tell the provincial government that CMI doesn't work? Like, I think for years and years and years, we've through whether it be the Warden's Chair or delegations or the Eastern Ontario Wardens Caucus, I'm sure we're not the only ones. How many times do they have to hear that, as the chair calls it, it's farcical?
Ms. Sheedy, please. I'm not sure there is an answer to that question. I think it might be infinity number of times.
Yes.
It might have just been a rhetorical question, but I find this so bloody frustrating that, you know, they put out these programs and the funding model doesn't make any sense at all. So it is rhetorical, but I just want you to know that I'm sure all of us recognize that, you know, we've tried to make them understand this does not work. And, you know, I get that we have a delegation with Minister Fullerton, but that this isn't the crux of that delegation. So it's just, yeah.
So, Mr. Chair, if I could respond, recognizing it is a rhetorical question, but, you know, Councillor Murphy raises some really good points, as you have previously as well. You know, what I didn't say is that, you know, not only is the funding mechanism farcical, but really what I should have emphasized that in order to get to there, There is an incredible amount of nursing admin time that goes into that we submit that data. Secondarily, and similarly, is the province pays, we are required, certainly the medium and larger homes are required to have a full-time equivalent RN administer or coordinate the RIMDS program, as it were, in terms of this data collection and submission to the ministry. And at the end of the day, it doesn't mean anything in terms of our funding. So you're right. It's been brought up in each and every forum we've ever had the opportunity to do it. This time, what we're doing is in the warden's delegation to the minister, we are trying to turn that into an opportunity. And we're saying, so you, Ministry of Health, have heard, despite which government was in power, you've heard for over 20 years that we need 4 hours of care per day. Here's an opportunity to take that funding of that RN that does not provide any care to the resident and turn that into whatever the home needs. In my case, it's PSW hours. In our case, it's PSW hours. And look what 100,000 could buy us. It could buy us 2 PSWs. And so that will be part of the pitch to the minister.
Thank you, Ms. Sheedy. Anything further on item number 7? Warden Robinson, please. Then Councillor Love.
Thank you, Chair. I'm just taking a little bit of latitude here. We're talking about the presentation to AMO. Just so committee knows that it's not just going to be the warden doing this, that the chair will also be a part of this process, because it'll be the Michael and Debbie show, and we'll see between the two of us if we can get anywhere. So just want to make sure that people are aware that I'm not doing it all myself. I'm bringing in the heavy guns.
More than happy to play the rhythm guitar. Councillor Love.
Thank you, Chair. I'd be very interested to hear you play the rhythm guitar. I just wondered, there's an enormous amount of data being collected through this process. Is there any other use for the data? Any use that's made of this data other than just to calculate funding and then turn around and not actually provide the funding that's needed for the data that's collected?
Deferring to you, Ms. Sheedy, please.
Thank you. Through you, Mr. Chair, to Councillor Love. Yes, and we would actually support its continuation. So it was designed to be a clinical assessment tool. It was never designed to be a funding tool. To my knowledge, we're the only province in Canada. Most use RIMDS as a clinical assessment tool, but not as a funding tool. There may be other jurisdictions in North America or perhaps even Europe, but to my knowledge, we're the only province in Canada that's using it as a funding tool. So yes, to answer your question, we would continue to use it in the clinical world, but it is the data collection and submission and all this silliness and the timelines that we have to adhere to for funding purposes.
Thank you, Ms. Sheedy. I would certainly argue that it is not precisely being used as a funding tool in Ontario either. Any further questions or comments? Just the final comment that I had on, and I understand that is a very information dense and complex chart on page 40 of the report with respect to the funding. Ultimately, as I was going through this, the increased of 273 on the global increase over and above the $1.77, it is what's driving that cost. As I understand, the $1.77 would have been extrapolated right through the entire 366 days of 2020. So the first 3 months or first quarter was the $1.77, and then it was increased for the balance of the year by an amount of $2.73. And just as I was going through this, I see in the Montshire Manor 2020 budget, it shows that the budgeted global increase was $87,615. That's actually in checking the treasurer's, in going back to the budget report and in fact doing the calculation of the 180 beds, 366 days, etc. That number should in fact have been $116,608 rather than the $87,000 cited. And likewise, in the change to the Miramichi Lodge, it is showing $151,362, when in fact, as I understand the nature of what's intending to be reported here, that number I believe should incorporate the budgeted number of 107.5 plus the increase of 124, which ultimately would leave that at $232 as opposed to 151, at least as I'm going through my charting. I'm not sure if, Ms. Sheedy, if you want to defer to Mr. Foss, perhaps. I'm not sure where that particular chart originated.
Yes, it did originate in the homes, but I would ask Mr. Foss, as our resident accountant, to please comment. Thank you.
Can anybody hear me? Oh, good. I got a message.
I certainly can. All the nods indicate everyone can hear you, Mr. Ross.
Sorry, Chair. I got a message from Zoom saying that my system had unexpectedly quit, so it sounds like I'm back on. Yeah.
Stop touching that button.
The calculations, at least that that I went through in trying to understand all of the funding announcements and the changes, I would have provided to the homes a spreadsheet that looks somewhat different than the report that you're looking at in front of you in this on page number 40. So my format is much different, really just calculating the difference between the budgeted CMI, the revised CMI, the number of days of funding between August and December, and for the global budget, the change from $1.77 to $4.50 for the period of April to December. So my numbers, my format is much different than what you're looking at. What I can tell you is that on the bottom line, the total change for Bonnechere Manor at that funding increase of $137,097. And for Miramichi Lodge of $111,665. Those agree to my worksheet, and those are the correct annualized changes or overall increases in funding that we'll have for both of our homes. Haven't really been through the rest of the data on this sheet. Looks like it's attempting to calculate total approved funding for those different periods and the differences, but I took a much different approach. However, the change column in the far right-hand column is correct, and those are the funding increases we'll receive.
Thank you for that, Mr. Foss, and perhaps I should have stated that at the outset. That is precisely what I have too. That those numbers of the total difference for both the manor at 135 and the lodge at 124,625 are precise, and at the end of the day, that is the increase of funding that we will be receiving. Thank you, Ms. Sheedy.
Sorry, can I just make sure the committee knows that we will go back and compare those numbers with Mr. Foss again. If there were any errors, we'll bring them to your attention. Thank you.
Thank you, Ms. Sheedy, and we'll probably revisit that as we go through the treasurer's reports as well. Is there anything further on the CMI funding? Long-term care minor capital program. I am certainly, there was a great deal of anxiety created when the province announced the cessation of both the structural compliance program and also, I believe, the high wage program. Dr. Fullerton, Minister Fullerton, had advised at a breakfast meeting at Algonquin College sometime in 2019 that it was their intent to replace the structural compliance, which I suppose this can be viewed as perhaps a reasonable / unreasonable facsimile to that, both in terms of the reduced amount, and in particular, given the challenges as identified by Ms. Sheedy with respect to air conditioning, which certainly predate COVID. But the other thing with long-term care that is certainly in front of everyone, it is the giant elephant in the room, is particularly all of those homes outside of Class A homes. Just today, I've seen again, I think Chief Nolan had made reference to it. There is more evidence coming forward of the airborne transmission of COVID-19, that circulating air within long-term care is an issue with respect to transmissibility of infectious disease. So it is certainly heightened under COVID. But the very fact of having a congregate sharing of rooms in various classes of long-term care homes is just not going to work anymore. I almost liken it to the system that we have essentially evolved in Ontario as akin to a just-in-time inventory, and it works so long as there is not the least bit of outside influence impacting. This is not the least bit of outside influence impacting COVID-19. It is an enormous impact, and has certainly demonstrated that the evolution has been an abject failure in meeting the needs of our seniors and those requiring long-term care. Of particular note, though, is the first that I had heard Ms. Sheedy announce this morning, that no longer would any remaining funds from this program be provided that they could be deposited into reserves for future capital expenditures, as had been the structural compliance program. And, perhaps drawing once again on the rhetorical question posed by Councillor Murphy, it seems that it is entirely counterintuitive, or the antithesis to where the province was moving into, recognizing with capital funding through the OSIF programs, et cetera, that on these large expenditure, big ticket items, there was an absolute need to recognize the requirement to put away monies, that this is now flying completely in the face of that philosophy of recognizing the responsibility of another senior level of government, which is municipal governance. That is deeply troubling and is I think, going to have significant impact, as significant, if not more so, over the long term than the reduction in the dollar amounts themselves. Item 9, the deferral of long-term care home accommodation rate changes. Item 10, long-term care home development funding policy. Councillor Murphy, please.
Thank you, Mr. Chair. I don't want to sound like sour grapes, but when Humber River Hospital, adjacent, as of yesterday, they're fast tracking 320 new long-term care beds at that facility. And knowing that rural Ontario is in great need, I'm not sure, I know that the County of Renfrew lobbies at every turn for anything that our residents need. But I did feel like it was a smack in the face yesterday to have 320 allocated in a city that actually has long-term care homes, but they haven't been taking care of their long-term care homes, so they can't admit people. And here we are in the County of Renfrew with a stellar record, thanks to our director and our staff. And these are beds that we need. And I'm sure that Renfrew County we're not alone in this in rural Ontario. So it's not a question. It was just something that really irked me yesterday, and I knew that we were going into this meeting today, and knowing that they're fast tracking them as well. I don't know what other lobbying efforts we can do, but that's just my 2 cents. Thanks, guys.
Thank you very much, Councillor Murphy. Anything further? I wish to address this also. I recognize that property values, just land values within the larger urban environments are certainly more than they are here. This fills me with a great deal of concern going forward on eating up a substantial amount of this allocation. And what I find a particular abomination, and I use that word given careful consideration, it is a curious thing that it is so much more expensive to build long-term care homes in the large urban environments, and yet we seem to be able to find those funds. It costs a lot more money to extend broadband into the rural parts of Ontario, and yet we never seem to be able to find those funds. So I do find it completely mystifying how the large urban environment, we seem always to be able to find means of funding these financial challenges, and yet we are bereft of any sort of solution to the challenges that we have in rural Ontario. And it fills me with a great deal of dread. We are beginning to hear the conversation, in my estimation, happening now, that there is no question that COVID-19 has been very asymmetrical, certainly outside of long-term care, perhaps even within, that it is the large urban environments that have borne the largest brunt of this, and I'm certainly sympathetic to that. But I'm now filled with a great deal of concern that as we're moving forward and beginning to address the long-term solutions towards pandemics, global pandemics, it will be with a view towards expending a great deal of financial resource towards hardening those large urban areas. Rather than recognizing what's happening, people are now voting with their accommodation. I'm sure everyone here at this committee, probably most of Renfrew County, is very much aware of the dramatic uptick in real estate values and the number of people that are at the very least finding second accommodations, if not primary accommodations, out in the rural parts of Ontario. The population of Ontario is now telling everyone that our cities probably are big enough. And yet I'm filled with concern that in the long-term response to COVID-19, it will be to expend an enormous amount of the provincial treasury to harden the large urban environments. Councillor Love.
Thank you, Chair. I would note to committee that although not a municipal home, Valley Manor in Barry's Bay is a not-for-profit home. It needs to be redeveloped. The deadline is 2025. One of the challenges it faces is that there's a significant component of fundraising that is expected to go into this project. When you're fundraising in a small community in a rural area, you're not going to be able to achieve the levels of capital that to invest in a redevelopment that you would be able to achieve in a city. I'm deeply concerned that if we don't hear soon that there's going to be a significant investment from the government in this long-term care home, we're going to lose 96 beds. And that's 96 beds that serve residents of Renfrew County. So while municipally funded homes are struggling, there are not-for-profits that are struggling as well. And they're going to have a big impact if they cannot get this funding from the government, if it's all headed towards the cities. And this project is ready to go. It is shovel ready. The land is acquired. Everything's ready to go, but they're struggling to meet the level of funding that they have to raise from our community. So, you know, this is going to be an issue that affects us all. Thank you.
Thank you, Councillor Love. Anything further on the development funding policy? Councillor Lafreniere.
I just want to say, I mean, everything everyone said, Councillor Murphy, Councillor Love, it's all, I mean, it's based on reality. In the smaller communities, we seem to get forgotten. But sitting and discussing it and not making a little noise in the form of a resolution or a letter to the minister or the premier, maybe that's what we should do. I mean, we hate to make it look like, you know, they're doing it and we want it, but that's the reality. I mean, the fact that they were hit harder by COVID I mean, because we did it right, we shouldn't be penalized, going forward. So I think we need to take an action and make it known that, although we sympathize with the larger centers, it's a lot more affordable to build the homes here. And why are we being overlooked? So I think that we should be sending something off.
Perhaps I'm just wondering. I'm certainly not in any way opposed. I endorse, frankly, the notion of making our concerns heard. But I think that it probably should take some careful distillation as opposed to the initiative that we took with respect to the VTAC. Perhaps something could be prepared and brought back to the September Health Committee meeting, if that is satisfactory to Health Committee.
I would support that.
Mr. Morrow, do you want to speak to that, please, as well?
Thank you, Chair. Through you to committee. One of the suggestions I've been talking to Shelley and the warden about is including something along those lines with respect to infrastructure and the need for seniors infrastructure within the county of Renfrew as part of our delegation to Mary Lee Fullerton, Minister Fullerton, that will be coming next week. So that speaking component will be part of that presentation. I'm not sure if that satisfies committee.
If I might, I think of course, that's going to be tied to the seniors housing strategy as well. This thing is multi-pronged, but perhaps I think for the purposes of today, if we defer anything coming from committee or a recommendation for council to direct the warden, perhaps that's something, Mr. Morrow, we can work on towards the September Health Committee.
Yep.
Okay,
we can do that, sir. Thank you.
All right, thank you. Anything further on the funding policy? I see none. Item 11, the Jaleese Public Inquiry Reports. Item 12, the virtual summer school. Again, I'm certainly going to acknowledge and commend Ms. Sheedy, who has established a significant presence in the long-term care community, justifiably very pleased that the initiatives and innovation that she has been driving here in Renfrew County and that we as the council, committee and council have embraced is being recognized across the province. The seniors housing strategy, item number 13. Again, just very briefly on this, I think it is long overdue to recognize the continuum. Once again, this speaks to the collaborative effort of multi-agency cooperation in getting this stuff done, meeting the needs of our community. I think that there is a growing, certainly I have a growing awareness that there has not been a role typically for municipalities with respect to healthcare, but that's been a mythological as much as the CMI is. There's so much more expectation on us, if nothing else, certainly through the budgets here for long-term care and paramedic services. But along with that, as you will note at item 22, the enormous importance that fundraising in the community has now come to be with respect to the full spectrum of healthcare provision. So I'm very pleased that this is moving forward. And once again, I think that Renfrew County is leading the way in being innovative and recognizing that warehousing our seniors is not the solution. Item 14, the treasurer's reports. I only wish to bring these up because I think perhaps, and I'll have this conversation offline. First off, Councillor Doncaster, I do see a question.
Sorry, thank you. I just had a question. I could have asked it earlier. I just wondered if all of the numbers, I've lost track of my in my notes, but from items 6 and 7, are they included in this treasurer's report?
I'll take the first stab and then defer to Mr. Foss. I am presuming that they came too late, probably to incorporate or capture any of those. In fact, if they came in July, they would not have been available when this report was made at the end of June, but I'll defer to you, Mr. Foss. I wonder if Zoom has booted him out of the meeting once again.
I'm having issues here as well with Zoom.
Okay, perhaps, oh.
Your answer is my assumption, but I just want to validate that.
Okay, okay, Ms. Sheedy, can you answer that, please?
Certainly to be confirmed, Mr. Chair and Councillor Doncaster with Mr. Foss, but my understanding is until the funding actually flows, regardless of whether it's retroactive and all of the rest of it and the announcements, Mr. Foss does not include it on the expense side or on the revenue side. So the answer to that would be no, to the best of my knowledge. So for example, in the one-time funding, we have received 95% of the pandemic pay. So that is there. We have not received the other 25%, despite it being announced in April. So until we receive it, you will not see it.
All right, thank you. Is that satisfactory, Councillor Doncaster? All right. My only comment on this, I think that, thank you, Councillor Doncaster. I think that it is very difficult. This is a lot of wheels spinning related to COVID. So certainly the items that I had provided to Ms. Sheedy prior to today's meeting were all on those COVID lines that show up across both long-term care homes. And certainly they seem to be extra expenditures just to run kind of the normal series of events, such as visitation, etc. But on top of that, you have a whole separate envelope that is the pandemic pay. There is some response through, I'm fairly certain, the global increase that is probably recognizing this at some point. And I know that this would be a monumental task, but I think for us in our role, both as committee and council, to provide appropriate oversight to recognize what has been the cost to the treasury of the county of Renfrew in responding to COVID-19, recognizing certainly funding that would be coming from both senior levels of government, but also that's coming from our own levy resources. Moving on, item 15, the bargaining with Monasher Manor. That's to be addressed again in the closed session this morning. It's no longer morning. Moving along. Any questions on 16, the roof replacement project? Item 17, the HVAC system. Item 18, the Ministry of Long-Term Care inspections. Item 19, the health unit inspections. Item 20, the environmental services supervisor position. I'm going to take advantage of this to both welcome Mr. Keller. Very pleased to have you joining us this morning and wish you well in your new role with the County of Renfrew, and at the same time recognize the 8 years of dedicated service of Darrell Berger to Miramichi Lodge and the residents there, and to our larger community. Outstanding to have had you as part of our employment team here at the county. Item 21, expressions of gratitude. Oh, sorry, Ms. Sheedy.
Thank you, Mr. Chair. Before we leave staffing within the long-term care homes, I thought I should update you on a new development post this report going out, and that is that Shelley Yantha, the Director of Care at Monasher Manor, has accepted the administrator position at North Renfrew Long-Term Care Home in Deep River. So we will be losing her. And I wanted to let you know that I have appointed Tricia Michaelis on an interim basis as an acting DOC while we go through the recruitment process. And consequently, I will be looking to replace Tricia in an acting capacity, as we definitely need 3 nursing managers at this point in time. So I look forward to bringing you more information on that as the recruitment process evolves. And I will include it in the next month's report, but I know you will similarly want to express your thanks to Shelley. She's been with the Manor for over 7 years, and we're going to miss her. Thank you.
Absolutely, and I am very pleased that you brought that forward for this meeting, Ms. Sheedy, because I certainly, on behalf of myself, but on behalf of committee, council, and the residents of of the County of Renfrew once again extend my appreciation for all of Ms. Yantha's efforts on behalf of our larger community and the community at Bonnechere Manor. So thank you very much for that. Item 21, expressions of gratitude. Item 22, fundraising. Just a single comment. Again, fundraising has become an integral. Sorry, I will defer to you, Councillor Murphy.
That's okay. You go ahead.
Thank you. I just, because fundraising has become an integral component of the financial resourcing of the full spectrum of healthcare providers, I'm very pleased at and congratulate Ms. Lainey Bolt Johnson on her outstanding efforts in responding in the incredible constraint that has been delivered upon us by COVID-19, how very innovative and unique much of these efforts are. So commend Lainey very much for that. Councillor Murphy.
Thank you, Chair. Through you to Shelley. I'm not going to lie, Shelley, I'm a bit disappointed. I was going to put my gown on in my living room and have a glass of wine here. Come on. Oh, are we high-fiving?
Ms. Shiddy.
Thank you, Mr. Chair. Through you to Councillor Murphy. Please dress up away. You absolutely can. We were just thinking that for some people, men, it might be a deterrent. They may not have attended galas in the past or may not have willingly wanted to attend them because of the dress up component. So if you want to, as Mr. Lemke used to always say, fill your boots.
If I may, Mr. Chair, all joking aside, I couldn't agree with the chair more. I mean, I think that what you've done is you've taken, you know, this terrible time and your staff has managed to find some unique ways of continuing fundraising. And I think this virtual coffee house is a great idea. And certainly, you know, we can all participate and see each other because I know we are missing each other. So again, congrats to you and your team on some really innovative fundraising opportunities.
Thank you. And I will definitely take that back to Lainey. Thanks.
And I need to express my appreciation for the clarity, given that it's a coffee house. I was going to have a smoke machine, get my beret out and grow a goatee and recite some spoken word poetry, thinking that this was perhaps a beatnik coffee house. Thank you for providing clarity on that I would not stand out like a sore thumb.
And Mike, you need bongos. Don't forget.
Bongos and my rhythm guitar. In any event, can I have a motion to accept the report, the long-term care report as a whole? Councillor Murphy has so moved. Councillor Love has seconded. Any further question, comment, discussion? All in favor? The motion is carried. The report is adopted. With that, just bear with me one moment as I return to the agenda. We do have the Board of Health minutes attached as information. Any question or comment on the Board of Health minutes? With that, I do see Councillor Murphy.
Sorry, Mr. Chair, we went over Paul's report. There's an admin report.
Oh, I am terribly sorry. You're absolutely correct. I'm quite astonished, actually, and disappointed. Ms. Sheedy had identified that their Zoom AGM at Advantage this morning went without a hitch. I can't believe that. So this is my hitch, Mr. Morrow. Oh, sorry. I do see a question from Councillor Doncaster, presumably on the long-term care report.
No, on the Board of Health.
Oh, on the board. Sorry, I skipped over with your acknowledging that. I will first defer to Mr. Morrow, and then I will come back to the Board of Health minutes.
Thank you.
Mr. Morrow, the administration report. My apologies.
No, I was hoping you were going to miss it. Thank you, Chair. There is only one item in the administration report. It's an information item as it relates to announcements around Ontario health teams. And there are several appendices attached. mostly news releases around Ontario, announces 5 new Ontario health teams. More specific to this particular area, though, is the Ottawa East health team that takes in that portion of Ottawa, parts of Prescott, Russell, and others. Anecdotally, I have had some feedback from local hospital CAOs. As far as we know, there is no move afoot to have a health team or any such announcement in Renfrew County. It's our understanding that the province continues to reassess Ontario health teams, but we are not in the mix as of yet. Chief Nolan may have something to add there as well. Thank you, Chair.
Thank you, Mr. Morrow. Any questions, comments on the administration report, item number 1? I think in my estimation, perhaps equally intriguing to me was the, I think in development perhaps, was the Leeds, Renville, and Lanark, and also Frontenac, Lennox, and Addington. I think that those are ones perhaps to keep an eye on also, perhaps be gathering information. I am pleased. I recognize the disruption that has been visited and started pre-pandemic. But I am pleased that there is still an opportunity for fruitful conversation with all healthcare providers in the county of Renfrew, that perhaps even the VTAC may be incorporated into what will be the long-term solution to Ontario Health Team in the county of Renfrew and city of Pembroke. With that, then, can I have a motion to adopt the administration report? Councillor Grill, seconded by Councillor Bennett. Any further conversation? All in favor? That is carried. Thank you. Now, I did already broach the board meeting minutes from the Board of Health. Councillor Doncaster, you had a query.
Thank you, Mr. Chair. I had 2 questions. One is just, I guess, procedurally. Is it standard practice now that the Board of Health, all of the resolutions are done by recorded vote?
Yes, that has been the evolved practice, I guess I would answer.
Okay.
Sorry, it probably
there's a delay on somebody's end.
It probably it may be illuminating also that they have continued to be by teleconference as opposed to any kind of visual medium, which I know that there is an opportunity to poll membership without it being particularly a recorded vote, but in any event, that is what has been driving this. I know that investigations are being done as we're moving forward in the pandemic as to perhaps a visual electronic means of conducting the Board of Health meetings.
Okay, thank you for that. It was just curious. I was just wondering. And I apologize, there's a delay here. I don't know if it's whether it's on my end or your end, but when I stick my hand up or when I start talking, there's at least 5 seconds before an acknowledgement of anything going on. So anyway, I'll leave that. So my second question was around, and I think this flowed from the May 26th meeting and then continued on in the May and June meeting. And I assume there's been meetings since that, but it's around the resolution on page, starting, I think, on page 77, 78, where I think the resolution was to bring back a previous motion and it was defeated. I'm wondering if there's been any progress on that. I'm assuming there has been.
Okay, if I might, I'm looking at 77, and it was with respect to the selection committee. These are quite stale dated. I think the minutes you're referring to were the May, and again addressed, I think, at the June meeting. In any event, the fit up of the 141 Lake Street the new head office for Renfrew County District Health Unit is well underway. I know that there have been certainly some issues that have been found within the fit up, but I believe that it is still adhering to schedule. I know that certainly this is subject to Mr. Morrow, if you can confirm this. I know it's in the report for the Finance and Administration Committee meeting that the health unit, I believe, has vacated the classroom kind of area of the health unit so as to provide for the renovations to and modernization of the county administration building as well. I do believe that the fit up 141 Lake Street that will receive the health unit is well in hand and moving forward expeditiously.
Thank you, Chair. If I may, that is absolutely true. We have taken over the classroom. Yep. Sorry, we have taken over the classroom area. It is currently under renovation right now. With respect to 141 Lake Street, we have been approached by the landlord for further accommodations with respect to access to washrooms through POA. We are very concerned that there may be some challenges with respect to the timing of the repairs, given some hurdles they've come up against with respect to that facility. At the Development and Property Committee yesterday, staff were directed to ask the health unit for a delegation to Development and Property to speak about their timelines and any concerns that may be arising with some of the construction that is occurring on 141 Lake Street.
Okay, thank you, Mr. Morrow. That is certainly much more information that I have available to me. I see by your nod, Councillor Doncaster, I believe that is satisfactory. Anything further on the Board of Health minutes? I see none. With that then, I'm going to go on to new business. The closed meeting for the purpose of labor relations or employee negotiations. Can I have a mover to move into closed session, please? Actually, just before I do this, and I want to keep it moving along because I'm shortly going to get the glare I expect from Mr. Brose. Does anyone need a moment prior to going into close simply to visit the facilities? I am seeing a couple of nods. On my computer, it's 12:23. Can we just recess for 5 minutes tops and return at 12:28 to go into a closed session, please? I don't see anyone disagree with that, so that is what we are going to do, is recess for 5 minutes. Mr. Benke, if you can make accommodations for that.